A vegan diet can be healthy at any age. Nutrition is an important part of parenting, and with the right information and knowledge, there is no reason why a vegan diet can't be healthy for children. Children can get all the nutrients they need on a vegan diet by balancing food groups and also with the use of fortified foods and supplementation. Protein is a key nutrient, and this can be found in foods such as lentils, beans, pulses, and tofu. Soya is a good source of protein and contains all essential amino acids. Calcium is an important nutrient to help build healthy bones and teeth. Calcium can be found in fortified non-dairy alternatives such as milk and yogurt, and can also be found in fortified foods such as bread. Iron is also an important nutrient, and most protein sources are also good sources of iron. These include lentils, beans and pulses. Non-protein sources of iron include fortified breakfast cereals and fortified breads and wholemeal foods. Adding a source of vitamin C to a meal can aid iron absorption. Good sources of fat are important for growth on a vegan diet, especially for children under 5. These can be found in foods such as nut butters, ground nuts, avocados and olive oil. It's really important for children to have a daily intake of omega-3 fat. For more age-specific information, check out the Vegan Society Nutrition Guides for Children. Because under 5s can have smaller appetites and fibre can be quite filling, it is good to include some lower fibre options such as white rice and white pasta. Everyone in the UK should consider supplementation of vitamin D. However, it is recommended that children under the age of 5 also consider supplementation for vitamins A and C. Supplementation of vitamin B12 and iodine are important to consider on a vegan diet for children. However, it is a good idea to seek advice from your healthcare professional to determine which supplement is best for your child. Nutrition guides for under 5s, age 5s to 10s and for teens are all available on the Vegan Society website. These have all been peer-reviewed by a paediatric dietitian. If your child has any special dietary needs or you have any concerns, you can always ask your GP to refer you to a paediatric dietitian.